Hello, Mrs. Johnston. My name is Dr. Kevdog, and I'll be able to take care of you today, alright?
Hi, Miss Johnston. Nice to meet you. Hi,
Thanks.
Mr. Johnston.
This is some slimy
And here's some gloves.
hand sanitizer. Thanks. Let me see your thing. Can I check your? Can you go ahead and tell me your name and date of birth, please?
Gertrude Johnston, January 26th, 1973.
Nice.
Kind
Put this on your
of
finger.
a little bit.
Do you know where you are today?
I'm at the hospital.
Okay. Do you know what you're doing here?
I'm here for my colon cancer.
Oh, yeah?
Yeah. So I was actually checking your report, your H&P. It looks like I did see that a couple weeks ago you came in with some severe abdominal pain,
Yeah,
right?
my stool's been really loose, and yeah, I've been having some pain and feeling like nauseated, I guess.
What's your pain at on a scale of 0 to 10 right now?
It's about at a 5 right now.
Out of 5? Okay. All right. So just to cover everything real quick. So
Can I stick this in your mouth real fast?
oh, I'll go ahead and wait. Oh, I'll keep talking. So
Respiration.
just to review everything, you did come in with the abdominal pain. We did a CAT scan. We saw the tumor. Saw that it was some colon cancer, colorectal cancer. We went in, had some surgery, gave you the colostomy bag,
Take this one.
and we put you on some chemo medication to make sure to suppress that tumor growth, right? So it's been looking good. We went ahead. That was about that was like a month and a half ago. We did another CAT scan a couple weeks ago, or really recently actually. It looks like it was a week ago, and it looks like we are seeing some decrease in the size of that tumor. So that's good news. That's positive news. We like to hear that.
Her vital signs, her temp is 96.8, pulse is 78, respirations 18, BP 128/90. And what'd you state your pain as?
5.
Okay. Out of 10?
Yeah.
Okay, and she's oriented ×4.
Alrighty. Do you? I just wanted to confirm. I saw on your chart, but do you have any allergies that we should be aware of?
No, not that I know of.
No allergies? Alright, awesome. So I'm gonna go ahead and do a quick abdominal assessment on you. I just wanna make sure everything still sounds good and all that. So
Don't be too handsy.
okay, alright, and nothing, it'll be real brief. So go ahead and just lay down on your back real quick.
Okay.
Thank you.
Yeah, I
Assistant?
I always
pre-sanitized
feel
that.
like this thing is gonna fall off me.
Oh, that sucker's attached to your bowels. That sucker's not coming off. Alright, so what I'm gonna do is I'm gonna go ahead, I'm looking at it. We're looking level, we're looking good. So I'm gonna go ahead and palpate it. I want you to tell me if you feel any kind of tenderness, okay?
I
Any-
have some kind of up here.
Okay, alright, well let me just see. So, any tenderness?
No.
Any tenderness? What about right here?
It's a little high.
Sorry, it's just for the health assessment, you know what I'm saying? So we are having pain right here, you're saying, yes? So that is really close to the stoma site, so since it was put in pretty recently, that's nothing to be too concerned about. My
So-
nurse here is gonna go ahead and give you that morphine to help reduce that
Pain in
pain.
how many quadrants, do you say?
Like
3?
3 quadrants? What can you point them all out for me?
right here, mainly right here,
Uh-huh.
but just a little bit in the other ones.
You are having a little, okay. Well, I'm gonna go ahead and give it a little quick listen, alright, if that's alright.
He's
Let's-
quite good at listening.
Yeah, it's a specialty of mine. Oh yeah, I hear bowels.
Yeah, I ate some hot Cheetos before I came in.
Oh, you ate some hot Cheetos before you came in? And did you say those were hypoactive bowel sounds?
They're actually a little bit hyperactive. So, that could explain. I do notice that in your colostomy bag, your stool is a little bit loose. But that's okay. We're gonna go ahead and give you some. My nurse here is gonna go ahead and give you some loperamide, and that'll help solidify that sucker up. You know what I'm saying?
It's gonna be like.
No, it's not
It's
gonna
gonna be like a rock,
hard.
straight rocks. No, I'm just letting. It's not gonna be rocks. It's just gonna be a little bit harder than that.
Yeah, it's just gonna be so it's not so loose, that consistency. It's gonna be a little bit thicker, and that's called loperamide.
And can you show me how you're gonna empty it if it's not gonna be that loose?
We'll say, we're gonna do that after we do meds. We will. Okay, and then you're going to get your morphine for your pain that you stated. That was 5 out of 10.
Can I sit back up, Mom?
Oh yeah.
Yeah.
Go ahead.
Do you
Go
need
ahead.
help?
Do you need some
Yeah.
assistance?
Okay. Now, what were you saying about?
So you're getting the loperamide for your diarrhea. You're getting the ondansetron for that nausea and vomiting you've been having. You complained of a lot of nausea. You're getting that morphine for your pain that you stated 5 out of 10, correct?
Mhm.
Okay. And then we're gonna give you cacidabine, and that's your chemo, right? You've heard that word before, right? Okay. And it says that This is your last day of chemo?
Yes.
And that's going to be followed by a 7-day rest period?
Yes, so you have been taking it for 14 days, this is the 14th day. So because of that, it is followed with a 7-day rest period. So we're actually going to let you go home today.
Yeah.
All right, but because of that, we are sending you home with some medications, and we do got to go ahead and let you know some education so that you can be safe at home, okay?
Mm-hmm.
So some of the things I want to go ahead and let you know with the capecitabine, so you need to be taking it, well, since you're not taking it, you don't even need to worry about it. Yeah. But you are going to be taking your you do have the prescription for PRN loperamide at home. If you are taking this, you need to avoid any kind of CNS depressants. So
Okay,
if you have any opioids at home, no opioids. Anything that's going to slow down the body, you don't want to be taking that, okay?
So I can't smoke?
We discourage smoking at all costs anyways, in general. But it is not good with some of these medications. So if you do need some education on some smoking cessation, we have plenty.
Well, I'm not talking about tobacco.
Oh, okay.
Oh, okay.
Well, that's all right.
You're talking about the green smokes? Yeah.
Just
I would try to
Be
avoid
careful,
that while you're
yeah.
on this medication. But remember that you're only going to take your loperamide if you are having those loose stools like that looks like, right? So, and then you're on Dancetrone, just like the same thing. You're only going to be taking it at home if you have your nausea and vomiting, right? And then your morphine, you're only going to be taking it at home if you have pain, not if you don't have pain. And then your ferrous sulfate, has anybody talked to you about that yet?
No.
Did they talk to
said
you
I
about
was
your labs?
anemic, but I don't
yeah,
really know.
I did notice that. So it seems like whenever you first came in with that severe abdominal pain, there was a little bit of we're suspecting that you had a little bit of an internal hemorrhage, so you had some internal bleeding. Okay. And so what that leads to is, since you're losing that blood, even though it's not technically being lost outside, it's still being lost from your organs, right? So your red blood cell count, your hematocrit, your hemoglobin is a little bit lower than it should have been. So that could lead to why maybe you were feeling a little bit fatigued, a little bit tired, maybe you were feeling a little bit cold.
Mm-hmm. And this chemo is going to make your red blood cells and all those components go down also.
Yes.
So that's an expected finding with chemo. And that's why we're treating it with the ferrous sulfate to kind of give back for what that's taken. Does that make sense?
And if you notice that this bag, the stool starts becoming a little bit darker, like green, that's nothing to worry about. This iron, it has that special effect. So you just got special poop now.
Do you still go out for drinks?
We actually do not recommend drinking on this chemotherapy.
So I have your
just try to avoid the
and
out,
this
okay?
is your chemo drug, and it's by mouth, 125
That's
milligrams.
fine.
And then I have your loperamide, 4 milligrams by mouth. And then you're on Dancetrone, 4 milligrams, and morphine, and ferrous sulfate. Oh, I got it, ma'am. And here's
Are any of these opioids?
Huh?
Any of these opioids?
No, that's going through the
Just making sure.
IV line.
Just making sure.
Okay. Yeah, we like to see that.
Oh, I dropped one.
That one could be important. Okay. Now I'm going to give her morphine, 2 milligrams, IV push.
Make sure you flush that sucker first.
And I'm going to first clean her off.
I like that. I like that.
Stick
It's
it
a good
on,
assistant.
flush it on. Okay, and now we're going to push it. Okay, and clean and put our cap.
Couple concerns that I have for myself.
Um,
No. First, my concerns, okay?
Watch the hand.
So, I'm sorry. My apologies.
I wanted to say something. Lately when I go out in town, a lot of people are looking at my bag, and I'm not talking about my purse.
Oh, yeah, I understand. So you feel a little bit insecure, huh?
Yeah.
That's totally understandable. What I would do.
Okay, well, since it's getting a little colder outside, you can wear a sweater over like that. And they sell, like, covered pouches for them.
Yeah, you can get it like all fancy and decorated, put some jewels
You
on
can put your
it.
name on it. Even if you
Embrace
want
it. Embrace it. You know what I'm saying?
to. And we're going to recommend you to some support groups to talk to fellow people that have colostomy bags, if that's all right with you. Okay.
But I do want to make sure. Are you aware of how to empty out this colostomy bag and how to change it out whenever needed, as needed?
A little bit.
A little bit?
Yeah.
Okay, well, so right here, where's this little Velcro area, okay? And if you open that up, you can just push all of the stool down, have a container, you can do it over the toilet. Go ahead and put it out, empty it out.
Like this?
Yeah, you would just open that up and pour it out. You don't have to do it right now though, because we're not near anything, so just relax, you know what I'm saying? And then also, I'm gonna go ahead and lift this up just a little bit, okay? Back here, there's these little flaps, okay? If you pull one of those, that'll go ahead and remove the bag, okay? It's normal for you to do that about every 3 days, okay? Whenever you do this, there's a couple things I want you to remember. First off, I want you to be washing your hands before and after, okay? Because we want to prevent any kind of spread of infection. If you're messing with fecal matter, that stuff's nasty. You know what I'm saying?
I had a cousin that did something bad with one of these once.
What'd he do?
I'll tell you later. It's kind of inappropriate.
Yeah. I think I've heard some stories about these stomas. I also, besides just washing your hands, I want you to inspect that stoma, okay? We literally took part of your colon and we brought it on the outside, okay? That's still an organ. We gotta make sure it's getting adequate blood supply. It's still alive. So I want you to inspect it. If you see any kind of purple discoloration, any skin irritation that's
Or if
really
it looks
abnormal,
pale.
yeah, any kind of concerning discoloration, I want you to go ahead and call me, okay?
Well, it's a little red now.
That's a
Redness
normal
is
color.
okay.
Mhm.
That's what we want, okay? That means there's blood. Red is blood, okay? Also, that's what I'm saying, man.
Okay, but I wanted to mention about that chemo drug. Have anybody talked to y'all about protective precautions?
No.
No.
No one?
Okay, so you go on a chemo drug, right? And then you're a high chance for all bacteria because your immune
These are
system's
opioids,
kind
sir.
of down, right? Does that make sense? Has anybody talked to you about that? Kinda.
Yeah.
Okay. So that'll include just so you get less bacteria around you, and essentially so you won't get infected like any further.
They're just telling me to wear a mask, I guess.
Yeah, you need to wear a mask, wash your hands going in and out.
Wash your hands, wash your hands, wash your hands.
Mhm.
Please.
And try to avoid like large crowds of people and stuff like
So I
that.
can't go to church anymore?
You can go to church
How
still.
big is your church?
I would try to. A lot of churches they offer the virtual
Well, I
experience.
go to Green Acres. here.
Maybe they have a little special balcony you could sit in or something like that. And no like fresh flowers, no fresh
Produce.
yeah, meat, anything like that. Sushi, none of that. And yeah, and just a big thing, like he said, wash your hands.
I can't eat my steak anymore, my medium rare steak.
It
Try to
needs
cook
be-
that sucker all the way through.
Mhm.
You know what I'm saying? We
So
want
well
everything. We want everything. Heat kills bacteria, so we want to kill all the bacteria as much as possible.
Well, no Texas Roadhouse tonight.
For you, honey. Just for you.
You could get them to
Well.
sear it all the way through.
Yeah, exactly. Concerning your insecurities with the colostomy bag, you did just get. It was about a month and a half ago. You did just get diagnosed with this cancer. I wanted to go ahead and follow up on you. See, how are you feeling with this diagnosis? This is a lot for a person to take in.
Do you have a support system that helps you?
Well, I have my
I help her all
husband
the
here.
time, but sometimes there's a smell. What can I do about the smell? Or is there a leak? Or
Sprays, spray the
Yeah.
room. You know, there's a lot of things that people need to take care of if it smells, mustaches that are falling off. It's
Candles.
just, anything like
Yeah.
that.
Or you can maybe get an air purifier at home, something like that sort.
Yes. But it is really good though that you're getting to go home now for
Mhm.
these little 7 days. It'll be a nice little. I know it's not necessarily the best being in the hospital, but it'll be good to spend time with family. Use them as your support system.
is there any follow-ups that we need to do?
Yes, we're going to refer you to outpatient services like a dietitian to encourage a higher
High fiber.
diet. To get that, if you get your fiber higher, basically, that's going to be less loose in that bag. And so maybe we could get you off of loperamide.
Can you go ahead and name some high fiber foods for me, please? Just like one, maybe two.
You know you like broccoli, honey?
I eat my special case cereal.
Okay. Oh yeah, that's really good. Any kind of whole grains, that stuff is good.
You like brown rice?
I like hot fries.
Hot fries? No, see that stuff's garbage though. Don't eat that.
Yeah,
It's not good for you. It's processed.
it'll inflame the intestines and all
Right.
that stuff.
IBD.
Yeah.
You want some of that?
What is it?
Irritable bowel disorder. Revoke my license.
Okay, and then the dietitian's probably also going to talk to you about eating low gas forming foods, so like broccoli and a lot of vegetables, stuff like that, because it causes a lot of gas. And where's that gas go? And
My husband said I love broccoli.
Hey, but it's okay if you do have a lot of gas. So I want to go ahead and go back to this. If you do start noticing that this bag fills up with a lot of air, but it's not necessarily like stool, that's okay. You could just go ahead and burp that sucker. So it's just like a baby, how you just be like patting their backs, Just
Yeah, I
you
have,
open the bag.
5 kids. Okay.
Until it's all gone, okay?
Alright. I think I can do that. You think you can do that for me, honey?
Yes.
yes, but gas forming foods are not recommended because of the chance of bag leaking.
I also, really fast, I did want to emphasize before we head out. Whenever you do go home, if you start experiencing any kind of signs of like an infection or you start feeling sick, like you have a fever, chills, anything like that,
Or if your
Call us
stomach looks
immediately.
weird, anything like that, if you're having really bad pain.
the thing is you're immunocompromised, like we said. That's why you're not wanting to go into the into large crowds. So if you do get an infection, it could be serious. So that's why we want to encourage, wash the hands, wash the hands, wash the hands. You want to avoid infection at all costs. And if you do have any kinds of signs like that, give me a call. You know, I got you.
And someone will be here shortly to schedule y'all's appointment with a dietitian, and they will give you a brochure on the colonoscopy group or colostomy group.
That sounds good. I appreciate y'all for helping me today and checking up on me.
Not a problem. Any other questions? Anything else we can help you with?
No, I feel a little bit better about my bag. Yeah,
Awesome. Sounds like a plan.
I'm gonna go eat some food, I guess. What is
Word.
Kev Dog?
Dr. Kev Dog. Don't forget the doctor. I worked hard for that,
Stay
like
off those
13
hot
years.
fries.
I'll try to.
My guy,
Watch your
fix
hands.
that mustache. It's garbage.